Dr. Ishwarappa Savadi from Gangavati, Karnataka. I have finished 9 months of online classes and finished stimulation training also. After finishing all the theory classes and simulation, it is very important to attend this clinical attachment. After understanding the theory part and after going through the simulation, you will come to know what actually is the IVF and other things. After coming to the clinical attachment, I have found so many things which are to be learned. The first thing is how to take the case history of the patient, how to counsel the patient, how to start the treatment. All the problems will be there with the patients. And even though we have learned so many things in theory classes about the stimulation protocols, after coming here, I learned that it is a tailorized method. Individualized protocols will be there for every patient according to their hormone levels and their history and their body mass index and other things. Every day we will be seeing the outpatients and we will be going through the case sheets, and every day we are seeing so many scans, especially the follicular scans and the Doppler studies on the follicular scans and the triggering methods, and so many newer drugs which are being used in the infertility treatment, and so many procedures, LIT therapy, endometrial NK cell biopsy and other things, endometrial CD138, and so it is very nice to be here to learn all the advances of the infertility management. And even in OT, I myself have done 2 egg pickups with a senior most consultant of this Medline, Dr. Anukotu, and intrauterine and intra-ovarian PRP installations are being done. So I have never seen it. Of course, many things might have been read, many things might have been told in the classes, but until and unless we come and see it in the clinical attachment directly, this practical experience definitely will mold us a lot, and that will make us to understand in a better way what exactly is the IVF, especially legend of infertility. Dr. Kamini Rao's OPDs are wonderful. Her art of counseling the patients, her talents of taking decisions on the patient's individual case, it should be learnt, it should be followed. All this experience definitely makes my journey of IVF more molded. It's very nice to be in this institution for the clinical attachment. Thank you one and all.